We looked at signs and symptoms of cystitis and pyelonephritis. We distinguished between bacteriuria, sterile pyuria, and sterile urine using the results of a UA. Now the next learning objective is ensure urine cultures are taken in patients with pyelonephritis or recurrent cystitis.
Okay, so here's the severity of urinary tract infections. So it goes from less severe to more severe. So note that cystitis is all the way to the left. So cystitis in general is a benign infection. If you don't treat it, it may actually resolve on its own, or it's possible that it can actually progress to pyelonephritis. Pyelonephritis, however, is a severe infection. Keep in mind that by the time it's pyelonephritis, it has actually infected the kidneys by now. And it can actually progress to bacteremia, and that's assuming if it's an ascending infection. So if the bacteria are actually coming from the bladder, so it's ascending, it's going up to the kidneys, and then the next step is to go into the blood, causing bacteremia. The other way to get it is actually the descending pathway. So if someone has bacteremia, the bacteria can come from the blood and go to the kidneys and cause pyelonephritis. So for pyelonephritis, we do need urine and sometimes blood cultures. And when I say sometimes, if someone suspects that it's already made it to the blood, that's when you're gonna need blood cultures. But you definitely need urine cultures to treat pyelonephritis. And then, of course, the very severe infection is urosepsis. Urosepsis basically means sepsis caused by UTIs. For urosepsis, both the urine and blood cultures are needed. So note that the reason we always get blood cultures is, this is an extremely severe infection. Patients, in fact, need to be admitted to the hospital because this is an emergency and it can lead to death. That's how severe this is if it's not, managed appropriately. So this is, definitely patients need to be in the hospital. Whereas for cystitis, because it's a benign infection, the patients do not need to go to the hospital. They can be treated outpatient. So typically patients end up going to their primary care physician. A lot of patients who get multiple cystitis throughout the year, they can actually get treatment over the phone. So if you already have a primary care physician established, sometimes you can call your doctor and the doctor will send a prescription to your pharmacy. Or sometimes the doctor can actually, if you already have established primary care physician and they know that you get or the patient gets, cystitis like 4 or 6 times a year, they can actually give antibiotics ahead of time, and then the patient can go ahead and take the antibiotics as they get cystitis. Because it's, for someone who gets cystitis multiple times, it's easy for them to identify the symptoms. And it also eliminates unnecessary costs of going to the doctors, for a benign infection. Especially, it will eliminate patients going to the emergency department. And then, of course, in the middle we have pyelonephritis, which is a severe infection, but it's not really an emergency. So it's recommended that patients should go to the urgent care clinic. So, urgent care clinics are, typically open 24 hours. So, patients typically end up going to the emergency department because, a lot of people are not aware that there are urgent care clinics. And that can actually reduce the cost because going to the emergency department is very expensive and it should be reserved for very severe infections. But the reason pyelonephritis needs to go, patients need to go to the urgent care clinic rather than outpatient is because urine cultures are needed. It's not something that the doctor can do in the office or over the phone. So at least the patient needs to go to the urgent care clinic and potentially to the hospital if needed. So who exactly needs urine cultures? So as I mentioned, pyelonephritis is a severe infection and cultures are needed to ensure appropriate treatment is selected. Urine culture is not needed for cystitis. It is needed for recurrent cystitis. And the reason is if someone keeps getting cystitis, it's likely to be due to resistant organisms. So for that reason, we need cultures to identify susceptible susceptible antimicrobial agents to make sure we treat it appropriately. And of course, complicated UTRs are also more likely to be due to resistant organism, and that's why we also need urine cultures to make sure we use agents that are susceptible.